Hello and welcome to your Chapter 15 video lecture where we are going to start discussing exercise is medicine. And this is part 1 where we talk about prevention of chronic diseases. And in this video we're going to discuss some key terms and talk about what prolonged sedentary behavior looks like and how it increases all-cause mortality, how exercise serves as medicine, aerobic physical activity that reduces all-cause mortality, the biological links between aerobic physical activity and reduced incidence of chronic diseases, and how resistance training reduces all-cause mortality, and lastly, our biological links between resistance training and reduced all-cause mortality. Let's start by looking at some of the key concepts in exercise epidemiology. First, that term, epidemiology itself, is the study of patterns and determinants of health and disease. Basically, it helps us understand who gets sick, why, and how we can prevent it. Then we have exercise epidemiology, which is a branch of that field, and it's going to focus on how physical activity and sedentary behavior influence our health and risk for diseases like heart disease, diabetes, and even mental health conditions. Then we have sedentary behavior, or what we'll refer to as SB in this lecture, and that refers to any waking activity that uses very little energy. So we're talking less than 1.5 METs, and they're things like sitting, reclining, or watching TV, even when you're at work and on your computer or studying and you're doing that seated, right? So even people who exercise can still be at risk if they spend too much time sitting. And then we have physical activity, and you got to know that this is different from exercise, which we're going to talk about on the next slide. So we'll refer to this as PA throughout this lecture, but it's going to include any body movement produced by muscle contractions, whether it's walking, cleaning, or working out, maybe gardening, and that increases energy use beyond resting levels. And that brings me to METs, which stands for metabolic equivalent of task. 1 MET is going to equal the amount of energy you use at rest. If an activity is 3 METs, you're using 3 times the energy of resting. When we total all of those activities across a week, we get our MET hours per week. And that's a way that we can estimate your total weekly energy expenditure from physical activity. Altogether, these concepts will give us a framework to really understand how movement and lifestyle behaviors are going to affect overall health. So some more terms here. We have physical fitness, and there's still research kind of looking at all of the different characteristics of this, but they will be in totality the characteristics that people possess that relate to their ability to perform physical activity. So things like strength, endurance, flexibility, and their cardiovascular health. Essentially, it's how well your body can handle physical demands. Now for the definition of exercise. The key here is that it's planned and structured, and we're doing it intentionally with the goal of improving or maintaining physical fitness. So all exercise is physical activity, but not all physical activity is exercise. And then we have physical inactivity, and this is different from sedentary behavior. This physical inactivity, which we're going to refer to as PI, describes individuals who don't meet the recommended physical activity guidelines. In other words, they're not moving enough to gain the health benefits associated with regular activity. And then finally, we have the concept of hazard ratio. This is a measure used in research to estimate the risk of death or disease in one group compared to a reference group. So a hazard ratio of 1.0 means the group has an average risk. And if we had a 0.8, that would mean that they have a 20% lower risk. And if you have 1.2, that means that they have a 20% higher risk compared to the average. So again, 1.0 is going to be our average risk. So understanding these terms will help researchers interpret how different levels of activity and fitness relate to long-term health outcomes. All right, so next we have prolonged sitting, which we just kind of defined as sedentary behavior. And it was first reported as a health hazard in 1953. We see that, and this is illustrated in this graph over here, that as we increase our sedentary behavior, so sitting, you can see in this bar here we have 4 to 6 hours a day of sitting. Here, 6 to 8 hours of sitting per day, and then over 8 hours of sitting per day. And so as that sedentary behavior increases, we also see that increase of all-cause mortality. Here we have, it's at a 1.3, right? So that means it's 30% risk above average. Here it's 36% above average risk. And then here we have 60% above average risk. And sadly, what we know now is that sedentary behavior and physical inactivity are responsible for greater than 5 million deaths globally each year due to increased risk of chronic diseases. When we say chronic diseases, we're talking about atherosclerosis, coronary heart disease, cancer, type 2 diabetes, etc. We'll talk more about some of those all of those chronic diseases in a few slides. We can also see that illustrated in this graph over here, where we have the same time points as far as how many hours per day we're spending sitting, and this is related to risk of death from coronary heart disease. So what are we talking about when we say atherosclerosis? This is a progressive disease that's going to result from a buildup of fatty plaque in the arteries, and that basically means that the artery is going to narrow. So let's look at that illustrated over here on this slide. What we're looking at here is one of the most important processes in all of medicine. So here at A, we see that this is a healthy artery. The inside of the vessel is going to be called a lumen. In fact, we see a couple of the red blood cells in here, and it's wide open. We see it's nice and smooth, it's unobstructed, and blood will flow freely through here and be able to deliver the oxygen to the tissues. This is what we're all born with. Now in image B here, we are seeing that this is where things start to go wrong. Over the years, starting as young as 15 years old and over decades, we're going to start to have small injuries to the atrial wall, often driven by metabolic dysfunction, inflammation, and elevated ApoB containing lipoproteins. So that's what I've put an illustration of over here, where we see our cholesterol. Let's pretend this is our LDL, and ApoB is a protein that is going to attach to it, which then allows it to attach to the arterial wall. So we begin to cause fatty deposits to form, and these deposits are called plaques. So you can see this labeled here as a complicated plaque. And what's key to understand is that this doesn't just happen overnight. It's a slow, silent accumulation. You don't really feel it. You don't have symptoms early on or as it's happening. You could be in your 30s and even look fit, but under the surface, the physiology is quietly changing. The arteries are beginning to narrow. The endothelium, which is that inner lining of the arterial wall, is becoming dysfunctional. And so blood flow starts to become restricted. You can see how little space there is here versus our healthy artery. Then in image C here, we can see what happens when this silent process becomes a crisis. In this angiogram, we see an imaging study of the coronary arteries, and this arrow is pointing to this narrowed coronary artery. And essentially, we get a blockage where that plaque has ruptured and the clot has formed, suddenly cutting off blood flow to the part of the heart muscle. This is really what causes a heart attack, not the slow narrowing itself, but the rupture of that unstable plaque plugging up that artery and stopping blood flow. And this is a real tragedy in atherosclerosis. It's preventable, but only if we pay attention early and long before these symptoms appear. And so today we're really going to discuss the importance of exercise and physical activity so that we can maintain this open artery as much as possible for as long as possible. And so let's talk about the biological links connecting sedentary behavior and physical inactivity to an increased risk of developing chronic diseases. And first, I want to discuss what visceral fat is, because that's going to be a part of our conversation here. So visceral fat, you could kind of see a picture down over here illustrating it for us, is going to be a type of body fat that is stored deep inside the abdomen. It surrounds these important internal organs such as our liver, our pancreas, and the intestines. Unlike subcutaneous fat, which we see pictured over here, and that lies just beneath our skin. And that's usually what we think of when we talk about body fat, right? We picture the kind of fat that we could pinch under our skin, our subcutaneous fat. But the more dangerous type hides deeper. It's wrapped around those organs. And again, we call it visceral fat because the word viscera means organ. And unfortunately, this accumulates quite quickly in our modern life today. We have prolonged sitting, which we know are long hours of inactivity. And even if we work out daily, it can gradually increase our visceral fat stores in our body. This kind of fat is not a passive type of storage. It's metabolically active tissue. It's going to release a cocktail of inflammatory molecules like cytokines, interleukins, tumor necrosis factors that constantly signal to the rest of our body that something is wrong. And over time, that chronic low-grade inflammation is going to become the soil where our chronic disease will take root. Our cardiovascular disease, type 2 diabetes, dementia, colon cancer, and even breast cancer are some of those chronic diseases. And sometimes you can even look lean, but still have a lot of visceral fat. So all of this is really about metabolic health. And if your lifestyle involves too much sitting, poor sleep, and a diet that's going to promote insulin resistance, it could lead to increased levels. The good news is that it is reversible. We want to make sure to have regular movement throughout the day, do things like resistance training, and maintain metabolic flexibility to help reduce visceral fat stores and inflammation that they drive. And what we're looking at here is the cellular consequence of sitting for too long. This image shows a skeletal muscle fiber, and it helps us understand why movement matters far beyond just burning calories. When you sit for extended periods, our muscles' normal metabolic machinery starts to down-regulate. Inside each muscle fiber, we have our mitochondria. And you may remember these from previous lectures that they are the power plants of our cells, right? And with prolonged inactivity, they are going to start to accumulate damage and produce more ROS. Remember, that stands for reactive oxygen species, or free radicals. And over time, that oxidative stress is going to reduce their efficiency. Now, when we look at the genetic level, we see near the myonuclei, there will be depressed gene expression for both mitochondrial and the contractile proteins within the muscle. So the cell starts to forget how to build and maintain the machinery needed for strength and energy metabolism. Now, if we look to the right, we also see an insulin receptor. When muscle isn't contracting regularly, its ability to take up glucose from the blood declines. And this is a direct pathway to insulin resistance, which we know is the cornerstone of metabolic dysfunction that eventually is going to lead to type 2 diabetes, fatty liver, and cardiovascular disease. And what's important to understand is how quickly these effects are going to cause insulin resistance, which can develop after just a single day of prolonged sitting. So we have to keep in mind that it's not that just exercise is good for us to do, but that inactivity is toxic for us. Skeletal muscle isn't just for movement. It's a metabolic organ that's going to balance our entire body. And one of the most consistent findings that we have in public health and exercise science is that increased physical activity significantly reduces the risk of all-cause mortality, meaning the overall risk of death from any cause. We'll be using that term a lot, all-cause mortality. So again, it is the overall death rate from all causes, regardless of the specific cause of death. It's a measure of the total number of deaths in a population over a specific period of time. Putting it another way, we can think of if you had a lower all-cause mortality risk, it means that you're less likely to develop or die from any cause of death, including the leading ones like heart disease or cancer and so on. So, what's truly remarkable here is that no single medication can replicate the broad system-wide benefits that regular physical activity provides. Exercise positively impacts nearly every organ system: our cardiovascular system, the muscular system, the brain, metabolic health, and even our immune system. In recognition of this, Dr. Robert Salas, pictured here on the top right, who served as president of the American College of Sports Medicine, launched an initiative in 2007 called Exercise is Medicine. The goal of this program was to encourage healthcare providers to treat exercise as a vital sign, something that should be assessed and prescribed just like medication. The idea is simple but powerful. Every patient, every visit should include conversation about physical activity because exercise truly functions as preventative medicine. I will say though, just because you're telling patients that exercise is important and prescribing it for them doesn't mean that it's going to change their behavior and they're going to do it. So we do need something a little bit more powerful than this. But anyway, this initiative represents a major shift in how we think about healthcare, moving from a model that focused more on like treating that disease that was diagnosed to one that is preserving their health through lifestyle and hopefully for their entire life. And we could see that illustrated in this graph, showing how when we have increased physical activity, so you can see here are the hours per week, it's going to sharply reduce the risk of all-cause mortality, with most benefits gained at moderate activity. Beyond about 70 to 80 hours per week, there's no additional reduction in risk, but also no increased harm. This article here from your text is highlighting the work of Dr. Robert Salas, who served as president of American College of Sports Medicine, as I said, who created the Exercise is Medicine initiative in 2007. And I'll just describe the core message again, but it's about that initiative that physical activity should be treated as medicine. Healthcare providers need to talk to their patients about exercise habits, rather than just taking their blood pressure and talking to them about their cholesterol. So in order to make this practical, the EIM program introduced the idea of physical activity vital sign, or PAVS, or PAVS. At every visit, the patient are asked 2 quick questions. How many days per week do you engage in moderate or vigorous activity? And on those days, how many minutes do you exercise? Their answers help determine how close they are to the recommended 150 minutes of moderate activity per week, which is the minimum effective dose for health. The goal isn't just to congratulate patients who are active, but to help motivate the ones that are not. And beyond clinics, the program has expanded globally to more than 40 countries and over 280 university campuses. So that helps to ensure that future health professionals understand how vital physical activity is going to be for lifelong health. And here are 7 key scientists whose work shaped what we know about exercise health. So I'm going to give you like a quick synopsis of each one. There's Dr. Jeremy Morris. He was the first to show that physically active workers like bus conductors had lower rates of heart disease than sedentary ones. That study in the 1950s launched modern exercise epidemiology. And then there was Dr. Ralph Haffenbarger, and he expanded on that, and through the Harvard alumni study, proved that regular physical activity lowers overall risk of death. And then we have Dr. Stephen Blair, who demonstrated that fitness level, not just activity, is one of the strongest predictors of longevity. Dr. Frank Booth helped explain why studying how exercise influences genes and cellular function to prevent chronic disease is important. And Dr. Victor Matsudo from Brazil focused on bringing this science into communities worldwide through public health initiatives promoting daily movement. Dr. Ulf Eklund from Norway showed that even modest activity can offset the dangers of prolonged sitting, which we know is a critical insight for today's sedentary type of lifestyles. And Dr. Bente Pedersen from Denmark discovered that skeletal muscle acts as an endocrine organ and is able to release interleukin-6 during exercise, which helps regulate metabolism and inflammation. This chart here is showing us the major causes of death in the United States in 2020. You can see that heart disease and cancer remained at our top two over here. Together, they account for nearly half of all deaths. COVID-19, of course, in 2020 was the third leading cause that year. That was followed by injuries, stroke, COPD, also known as chronic obstructive pulmonary disease, Alzheimer's disease, and lastly, diabetes. And if you kind of look at all of these leading causes of death, many of these are largely preventable through lifestyle, especially heart disease, stroke, diabetes, and even some cancers. So physical activity, healthy nutrition, avoidance of smoking can dramatically lower the risk of nearly all of these. And so now we're going to dive into how aerobic physical activity is going to protect against severe illness or death from COVID-19. Because regular physical activity plays a powerful role in supporting our immune function. Studies during COVID-19 pandemic found that people who were physically inactive for the 2 years before the pandemic were significantly more likely to be hospitalized, admitted into the ICU, which ICU stands for intensive care unit, or die from COVID-19 compared to those who consistently met the aerobic physical activity guidelines. This basically shows us that exercise isn't just about fitness, it's going to directly enhance our immune defense. It'll do things like reduce inflammation, improve our body's ability to fight infection, and in short, if we maintain our regular physical activity, it'll provide protection not only against chronic diseases, but against even acute infections. So it's one of the simplest and most effective ways to build resilience for your body. And here we have another figure that talks to us about prolonged sitting and developing chronic diseases. About 6 to 8 hours a day of that prolonged sitting is going to affect mortality risk depending on physical activity levels. So on the left, individuals are doing less than 2.5 hours per week, essentially very little activity, and they have about a 40% higher risk of death compared to the average. As weekly activity is increasing here, that risk is steadily dropping. By the time someone reaches about 30 to 35 METs, which is about 4 to 5 times the recommended level, the risk is almost completely offset. Mechanistically, prolonged sitting leads to an increase in visceral fat, which we know accumulates around the internal organs, and this fat is metabolically active, so we're releasing those inflammatory molecules that we talked about, like cytokines, that drive diseases such as heart disease, type 2 diabetes, dementia, colon cancer, and breast cancer. This figure is showing us how increasing levels of aerobic activity directly translate to a longer lifespan. So here are our years gained, right? The x-axis is showing us the weekly physical activity in Met hours. And at the recommended level of about 10 Met hours per week, people are gaining about 3 extra years of life. Increasing to 3 times the recommended amount adds about 4 to about 4.5 years extra. So regular aerobic activity reduces the risk of numerous chronic diseases, including colon and breast cancer, stroke, heart disease, and type 2 diabetes. There are multiple biological mechanisms behind this, such as improving their cardiovascular efficiency, reduced inflammation, better insulin sensitivity, and enhanced immune function. This figure here is showing us how increasing levels of aerobic physical activity dramatically reduce the risk of death from several major chronic diseases. You could see those diseases listed here: breast cancer, colon cancer, stroke, heart disease, and diabetes. And on the x-axis, we see weekly physical activity in Met hours. And on our y-axis, we see our hazard ratio of mortality, basically our risk of death. And our dashed lines here are showing us 1, 3, and 5 times the recommended activity levels. Notice how all the lines trend downward, meaning more activity equals lower mortality risk. And our steepest drop occurs for our heart disease, stroke, and diabetes. This shows us how responsive these conditions are to physical activity. Even moderate increases in activity, just 1 to 3 times the recommended level, which significantly reduce risk. Next, we'll talk about the risk factors for coronary heart disease. And these factors that are shown in the blue boxes are non-modifiable, and they are going to be increasing our age, we all get older, our biological sex, so being male, and our heredity, meaning that all of these being non-modifiable, that they can't be changed. These determine a person's baseline risk. However, the majority of factors shown here at the bottom are modifiable, and that's where our prevention really matters. Things like physical inactivity, obesity, high blood pressure, high cholesterol, smoking, and diabetes are all directly influenced by lifestyle choices. So regular physical activity, healthy nutrition, and not smoking can significantly reduce these risks, even reverse some of their effects. Here we see how aerobic physical activity improves the blood lipid profile, one of the key markers for cardiovascular health. So before training, the total cholesterol of HDL ratio is around 3.7. But after a period of regular aerobic training, it decreases to about 2.9. That reduction is important. A lower ratio means less total cholesterol relative to the amount of our good HDL cholesterol, which helps remove excess cholesterol from the bloodstream. And so regular aerobic exercise enhances lipid metabolism by increasing HDL levels and reducing LDL and triglycerides, which together lower the risk of developing atherosclerosis and heart disease. This table here is showing us the standard blood pressure categories for resting adults. We all know already from our previous lecture that a normal blood pressure is below 120 systolic and 80 diastolic. And when systolic blood pressure rises between 120 and 129 millimeters mercury, but the diastolic remains under 80, we label it as elevated hypertension, which is an early warning sign that hypertension could develop. Then we have our stage 1, where we have 130 to 139 millimeters mercury systolic, or our diastolic is 80 to 89. And stage 2 is when either number is going to exceed, either our systolic exceeding 140 or diastolic is going to exceed 90. And these categories are important because even mild elevations in blood pressure significantly increase the risk of heart disease, stroke, and kidney damage. And through regular physical activity, reduced sodium intake, weight management, and stress control, we can help keep blood pressure in the healthy range. This figure here is showing the dose-response relationship between aerobic physical activity and the risk of developing hypertension. So on our x-axis, we can see increasing levels of weekly activity measured in met hours per week again. And then on the y-axis, we see relative risk of hypertension. And the trend is really clear here in a linear fashion. As physical activity is increasing, the risk of developing high blood pressure steadily declines. Meeting just basic recommendation for aerobic capacity already reduces your risk slightly, but individuals who achieve 4 or even 7 times the recommended amount see the greatest benefit, up to about 30% lower risk of hypertension. And this demonstrates once again that physical activity is going to act as a powerful dose of medicine. This figure here shows how aerobic physical activity helps lower arterial blood pressure through several key physiological mechanisms. First, regular exercise is going to increase activity of nitric oxide synthase. This is an enzyme that is going to help produce nitric oxide in the blood vessels. So nitric oxide causes vasodilation, where we have a widening of the blood vessels, which will reduce resistance to blood flow and help lower blood pressure. Second, we are going to promote angiogenesis, the formation of new small blood vessels. And so this will help to expand the overall vascular network, which improves circulation and being able to deliver that oxygen to the tissues. And then finally here, we have a reduction in arterial stiffness, which allows our arteries to be more flexible and responsive. This will allow them to better absorb the pressure generated with each heartbeat. And altogether, these adaptations will explain why consistent aerobic exercise is going to be one of the most effective non-drug treatments for hypertension. All right, here we see how regular exercise is going to protect the heart from what's called ischemia reperfusion injury, which is the damage that occurs when blood flow to the heart is blocked, like during a heart attack, and then that blood flow is suddenly restored. Normally, that sudden return of the oxygen is going to trigger a burst of reactive oxygen species and free radicals, which damage the cell membranes and the proteins. So exercising helps by increasing the cellular antioxidants, which we've already talked about, how those antioxidants are going to neutralize those free radicals and prevent oxidative damage. Exercise will also improve mitochondrial function, allowing the heart cells to use oxygen more efficiently and resist stress. And finally, it will enhance our calcium handling inside of our cells, which prevent calcium overload that can activate enzymes that are called proteases that break down our heart muscle proteins. Now let's talk about how aerobic physical activity helps protect against cancer through these different mechanisms. When we have chronic inflammation, which is typically caused by that physical inactivity and excess body weight, it could lead to DNA damage and promote cancer development. Regular exercise is going to help lower inflammation and improve immune function by allowing our T cells and natural killer cells to better detect and destroy cancer cells. So here on the left, we are seeing a physically inactive or overweight person that has low-grade inflammation. We're releasing those inflammatory molecules. We are developing ROS, and that is leading to the cancer cell formation, which then can have those cells multiply rapidly, form a tumor, which can then gain access to either our circulatory or lymphatic system and metastasize and reach other organs. Now, our cancer cells are going to produce a large amount of lactate, which suppresses our immune activity. So we aren't even able to combat this as well as we typically could due to a lack of efficiency in our immune system. Physical activity is going to reduce this lactate buildup and help us to restore immune surveillance and slow tumor growth. So that's what we're seeing with our cells over here, our T cells and our NK cells. And in some studies, we see that immune surveillance and slow tumor growth as much as 67%. Exercise also increases our body temperature and blood flow, which will deliver more of these immune cells to the tumor site and raise our epinephrine levels, which can inhibit tumor growth pathways. Overall, by us meeting our aerobic activity guidelines, it can lower our risk of at least 13 major cancers, which we have listed over here on the right-hand side. It includes breast, colon, liver, lung, kidney, and endometrial cancers. So regular movement truly functions as a form of cancer prevention medicine. This slide is highlighting how aerobic physical activity is going to lower our risk of stroke by targeting its major risk factors. Physical inactivity, obesity, dyslipidemia, hypertension, and diabetes are all interconnected. And so by regularly exercising, we can positively impact each one of these by improving our blood pressure, by our lipid profiles, and our insulin sensitivity. Physical activity will reduce the chance of stroke occurring in the first place. And there are three main types of strokes. There's ischemic, which is caused by a clot. There's hemorrhagic, which is caused by that blood vessel rupturing and allowing the blood to spill out of the vessel. And then there's transient ischemic attacks, which are almost like warning incidences, like a mini stroke. And so when we exercise, that's going to directly protect our brain. It'll strengthen our blood-brain barrier. It'll boost our antioxidant defenses and increase the heat shock proteins that protect our cells under stress. And our brain is going to elevate BDNF, which is the blood-derived neurotrophic factor, which supports our neuron health and repair. Here we see that aerobic physical activity can also help protect the brain and lower the risk of Alzheimer's disease. With regular exercise, we can reduce both the oxidative stress and the inflammation, two of the main drivers of neuronal damage in Alzheimer's. And by lowering oxidative damage, our brain cells are better protected from free radicals, and reduced inflammation helps preserve normal signaling between our neurons. Our exercise will also help increase our blood flow to the brain, which ensures that our neurons are getting enough oxygen and nutrients while being able to enhance the removal of metabolic waste products, including amyloid beta, the protein that starts to accumulate between our neurons in Alzheimer's. And then most importantly, our aerobic activity is going to stimulate what's called neurogenesis, and that's the formation of new neurons. And we see an increase in the size and function of our hippocampus. If you remember, that structure, the hippocampus, is the area that's critical for memory and learning. So here we're going to talk about how aerobic physical activity helps reduce the risk of type 2 diabetes through multiple cellular and metabolic adaptations. So when we regularly exercise, we're going to activate a signaling pathway in our skeletal muscle, and that will enhance our energy metabolism. One of these key adaptations is going to be to increase our mitochondrial biogenesis, meaning that more mitochondria are going to be produced, and that is going to improve our muscles' ability to use glucose and fat for energy. We'll also see increases in the expression of our GLUT4 transporters on our muscle cells, which the GLUT4 transporter is going to be our gatekeeper for glucose uptake. When we see levels rise, more glucose can move from our blood into the muscle, and that will improve our insulin sensitivity. We will also see increases in our capillarization, or the growth of new blood vessels in our muscle tissue. And of course, if we have better blood flow in our muscle tissue, it's going to enhance our nutrient and oxygen delivery. So all of this together is going to help us have improved glucose homeostasis, keeping our blood sugar levels stable and significantly reduces the risk of developing type 2 diabetes. Here we see how resistance training or strength training is going to play a major role in reducing the risk of chronic diseases and premature death. So individuals who engage in regular resistance training are going to experience about a 20% reduction in all-cause mortality. And when we do aerobic training, we will see a 30% reduction in all-cause mortality. When we combine both strength and aerobic exercise, we see that those benefits are increasing over 35%. So beyond longevity, resistance training is helping to lower the risk of several chronic conditions, including certain cancers and type 2 diabetes. These benefits are going to occur through a lot of different biological mechanisms, such as improving our muscle mass, glucose metabolism, and our insulin sensitivity, while also reducing inflammation and supporting metabolic health. And when we're able to combine it with aerobic activity, we can see that the resistance training is providing the most powerful protection for overall health and long-term survival. Now let's talk about why muscle mass is important in cancer survival. Research shows that cancer patients with higher levels of skeletal muscle mass are significantly more likely to survive compared to those with low muscle mass. As this chart is showing us here, individuals with our low muscle mass have roughly a 9% death rate, while those with higher muscle mass see that number cut by more than half to around 4%. So our muscle tissue is not just important for movement, it's once again metabolically active, and that influences our immune function, inflammation, and our body's response to cancer treatments. And we know that resistance training can significantly reduce the risk of dying from several chronic diseases. Looking at the data, the people who engage in regular strength training have about a 30% lower risk of death from type 2 diabetes and a 20% lower risk from colon cancer. The reduction in heart disease risk is also notable, though it didn't reach statistically significant in this particular study. These effects are going to be due to the way resistance training improves our metabolic health, glucose control, and muscle function, while also helping to reduce inflammation and body fat levels. This figure here is showing us how resistance exercise plays a critical role in reducing our risk of type 2 diabetes. We already saw a similar figure, but that one was for aerobic exercise, right? So through strength training, we're going to see an improvement in insulin sensitivity, meaning our body can use insulin more effectively to regulate that blood sugar. And we see increases of our expression of GLUT4 transporters in skeletal muscle. And again, these are the proteins that help us pull glucose out of the bloodstream and into our muscle cells so we can use it for energy. And then we see that resistance training helps to reduce visceral fat, which is strongly linked to insulin resistance and chronic inflammation. And so altogether, we're once again improving that glucose homeostasis, having stable blood sugar regulation, and preventing diabetes. Here we're seeing how resistance exercise can contribute to lowering the risk of cancer. And so through strength training, we can help reduce chronic inflammation, which we know can develop and progress many types of cancers. And by reducing those inflammatory markers, our body becomes less susceptible to cellular damage that can lead to tumors forming. At the same time, we see an enhancement of our immune function, and that improves our body's ability to identify and destroy any abnormal or cancerous cells before they have a chance to multiply. And so together we are going to be able to have a reduction in our cancer risk because of these two factors working synergistically to reduce overall cancer risk. And here is our lecture summary. I won't read through it, but feel free to reach out with any questions, and I hope this gives you some evidence to continue being physically active and exercise in your life, throughout your life.